Data is everywhere in our lives. It shapes decisions, services, and the way society works. But when it comes to health data, it becomes more important. It drives research, it supports early diagnosis, and improves the care we receive. This project, Data Conversations, wanted to spark discussions of the value of health data in our lives. The goal was to create a space where researchers and the public could engage in meaningful conversations about data. By bringing people from different generations into conversations, we explore how each of us understands data differently and why those perspectives matter in health research.
The idea for Data Conversations came from the Scottish Collaborative Optometry-Ophthalmology Network e-Research Project, or SCONe, a nationwide project based in Scotland that collects and safely stores retinal images from routine eye exams to help detect eye and systemic conditions earlier. By analyzing these images, SCONe aims to advance eye healthcare and benefit the wider population. A key part of SCONe's work is involving patients and the public in the development of the research. Through this collaboration, we recognize the need for spaces where researchers and the public can reflect, connect, and talk openly about what health data really means.
So when we were thinking of this project, our target groups were those aged 18 to 25, and then those aged 50 plus. We felt, and I felt personally as a young student, that I don't have a lot of opportunities to discuss something like data with older generations. But diverse viewpoints, especially in research, are really important, and so we wanted to bridge that gap and try and engage lots of different perspectives.
To start the conversation, we used creative tools called cultural probes, followed by an in-person workshop in Aberdeen. The cultural probes were simple, hands-on activity packs that we sent to participants in advance of the workshop, and they included things like photography, mapping exercises, and even asking people to create their own definition of data and what it means to them. The idea was to give people space to explore their own thoughts and feelings about health data in a personal way, and this meant that everybody had time to reflect on their own ideas first, and then when we came together for the in-person workshop, people felt more prepared to share their ideas, discuss them openly, and to build on each other's perspectives.
The one-day workshop in Aberdeen brought together younger and older adults into shared conversations about health data, what it means, how it's used, and why that matters. We used group discussions and creative tasks so that we could compare our experiences, challenge some assumptions, and generally talk about why health data is different from other kinds of personal information. The aim of the session wasn't to reach agreement, but to listen, reflect, and learn from each other's perspectives.
Talking with others helped me see that there isn't just one way to think about health data. I think that hearing different experiences made both views more balanced and more informed. Having dialogue with the public makes sure decisions about data are made in a way which is clear, transparent, and understandable. This gives people a voice and helps shape practices that feel fair and respectful.
I think the main change, in my opinion, was that before the sessions and the project, public health data seemed very distant to me. Having gone through the project and the discussions and the workshop, I can now see it's much more relevant to me and to my community, and something that I now feel I've got a personal stake in. I think the most surprising insight I gained from the project was the amount of common ground that was shared between the researchers and the wider public. And even where there were some points of difference, we had the same goals, which were about improving public health, helping other people, and protecting privacy.
Public engagement projects like Data Conversations are important for research, as they bring people and researchers into the same space to listen and learn from each other. When we create room for open dialogue, research becomes more thoughtful, more relevant, and more connected to real life.
For us, this project showed that data is not just numbers. Data is linked to people's values, experiences, and hopes for the future. So when we invite people into the conversation, trust grows, understanding grows, and research becomes something we build together.